I stopped these daily briefings on June 16th, 11 weeks ago, 78 days to be exact. We had 2 new positive cases on that day. 5 people in the hospital, 2 in the ICU. 385 Albany County residents had died at that point. We're on a roll with the vaccine. We're at 63.8% of Albany County's population have received at least the first dose, and 58.1% that were fully vaccinated. With in the first dose vaccine rate for Albany County, 18 and above, the population is 74.5%. Now, just over the 11 weeks, we've moved forward, but at a snail's pace. 69.7% of our population has received at least 1 dose, and 63.9% are fully vaccinated from the first dose vaccine rate. For 18 and above is at 80.6%, which is good news. And then I had a meeting with my Capital District leaders yesterday, and we talked about the vaccine. We talked about the 3rd booster shot coming out. But we talked about incentives and how we can, what's working in other counties versus what they're doing, what we're doing. Because of the slow pace, it's been trying to give that incentive to get people vaccinated. So I do want to say thank you to all of them on that Zoom call yesterday. On June 15th, then Governor Cuomo announced the lifting of restrictions and getting back to normal. The state celebrated with fireworks and people let their guard down. Yes, we're at a good place, but Dr. Whalen and I have had said for the last 18 months, I think, 18 months, that we're following the science. And the alarming part was when the governor said then it was over with and fireworks, it set the mindset for people that it was over with, that COVID went away. It didn't. I watched counties drop their emergency powers. I watched people walk away saying we're good to go. I never gave up my emergency powers because we were still in a health crisis. Yes, things were getting better. Things were going down, and they're going in the right direction. So there was no need to do daily briefings. There was no need to come out here. And look, we're not here to scare people. We're just here to give you the facts of what's going on and how we can best serve our community for the safety and health of our residents. And when the governor did that, and I saw the fireworks, all I could think of, and you think when you're a kid and you're Little League, you win a game or something like that, I thought of this friend of mine, Mike Wagner, who was celebrating on the 1st yard line when we were playing Colony Pop Warner, and he got tackled because he thought he was in the goal. He thought he was in the end zone. He thought he crossed over. And I don't know why we did what we did, because it gives the fault. So yes, things are better. We're going forward. That's what Dr. Whalen and I said. We don't need to do these daily briefings, but it wasn't over with. And mindset is half the battle, that we have to remind people. No politics, no anything else, but just getting it done. And I like to remind everyone, every individual matters. Every individual makes a difference. Jane Goodell said that. I have time and time called it a marathon, not a sprint, because we're not yet at the finish line. The CDC has labeled most of the state as high for communicable transmission of the virus. We're seeing this even as our numbers of new positive cases hit levels that we haven't seen since February. And hospitalizations as high as March and April, with 10 people in the ICU, and a number that we haven't seen since last May. And our hospitalizations and deaths were not on a course of December of last year, where we're at now, almost a year later. And I think Dr. Whalen and I have said this before. We never thought we'd be sitting here 18 months later. We never thought when this started it would still be going on. Vaccines have changed everything, because they have. Getting vaccinated, rolling up the sleeve, helps you in the right direction. And we know that people are vaccinated or getting COVID and passing it to others. We never once sat here through any one press conference, because as I spent the summer going around and people saying to me, well, I said, no, that's not. I said, if you heard Dr. Whalen correctly and clearly, as I did, we said, no, it's just like the flu shot. It's going to give you a level of protection. So if you get it, hopefully you don't get sick and end up in the hospital. If you do end up in the hospital, you don't end in the ICU and you get out quicker. And yes, you're still going to get it and you're going to spread it to people. So that's why he said you still have to wear your mask, stay 6 feet apart, cough into your arm, and sneeze into your arm. Still keep them precautions. But we must continue to get people vaccinated. So I say to everyone out there who's been waiting, was waiting for the approval from the FDA, please, it's been approved. It's no longer an emergency order. Go out and get the vaccine. Do your job, roll up your sleeve, help us move forward. You know, we've learned so many lessons, and I could sit here for hours talking about every decision we made 18 months ago versus today. I'm not advocating for shutting down. People want their kids back in school. That's why we got our great superintendent from Albany here, you know, to discuss this. But we need parents and people to do the right thing to go forward. And again, we must continue to put them practices in place, cleaning their hands and everything else. I actually read a good quote, or someone sent it to me. So it says, you cannot fix a problem that you refuse to acknowledge. And that's the problem. People don't want to acknowledge it and say, oh, it's over with. It's not over with. We're preparing for September 20th, awaiting the final approval for the booster shot so we can move into the next phase. Governor Hochul and her team have made it clear that they're going to turn it back over to the health experts, which has always been our county health, led by Dr. Whalen and her team down there, to make these decisions, which is something, you know, everyone knows how it's been for the last year for us. But it's also challenging, because one of the things when I was talking to the leaders of the Capital District yesterday, fatigue, tired, medical corps that's burnt out, health department that's burnt, and not just the health department, our nursing home, our COs, everyone is just tired because of everything that's been going on this last 18 months. And now to have to gear up for a third vaccine, the state did make it clear they're not going to have the big vac sites. They're not going to do Albany. And one of the things I brought up was the fact that FEMA came in, and FEMA helped us. And that's one of the reasons why a lot of our numbers were better than most other places. So there's that gap we got to fill in. And then you got to convince people to take the third vaccine shot if they want to, underlining health issues in the beginning, and then it will go from there, booster shots. And Dr. Whalen will talk about it. It's after like 9 months you can get your first booster shot. But since we've managed to get nearly 73,000 doses of vaccine through August 29th, again, we're waiting to hear more about the shots for our kids under 12, which Dr. Whalen will talk about when they turn it over to her, because that guidance is coming out shortly, I believe in a couple of weeks, but she'll talk about that. We've made great progress with our kids going back to the classroom, but we need to stay vigilant. The parents with the arguing over the mask, not wearing the mask, unmask our children. I feel for the superintendents, I feel for the teachers and the people that work in that building. I actually showed up at a gentleman's house that challenged to talk to me about who's leading the No Mask to Children's campaign, and I went and talked to him at his house. Gotta say, it wasn't there long, but we agreed to disagree, you know, but the reality is I understand his point. I really do understand his point. But we're in a health crisis, and look what's happening in Illinois, Georgia, Texas, Florida, and I can cite cases, and thank God I don't want to sit here and say, well, it's finally, I don't even want to bring it up, but I just want to say, thank goodness it hasn't happened here. You know, thank God. You know, and the reality is, when you see it happening elsewhere, and their vaccine rate is a lot lower than the state of New York, and that has a lot to do with it. But again, let's do this for the kids. You want them back in the classroom. It's about mental health, and the mental health for our children have suffered. And the only way it's going to get back to some type of normalcy is to get them into the classroom. But again, when the Superintendent Adams talks, and we'll talk about kids returning to schools and the new norm for them too. But as of today, we now have 26,800 cases of COVID-19 in the county to date. There's an increase of 97 positive cases since yesterday. Over the last 5 days, there's been an average of 78.8 new positive cases each day. Back on June 16th, there were 2.8 new positive cases each day. There are now 516 active cases in Albany County. Just back on June 16th, we had 16. So think about that. In the last 78 days, we've gone from 16 to 516. There are currently 824 people under mandatory quarantine. That number was 35 back on June 16th. There are 76 recoveries since yesterday. There are 3 new hospitalizations overnight. There are now 25 people currently in the hospital from the virus, and on June 16 there was 5. There are 7 patients currently in the ICU, and on June 16 there was 2. Unfortunately, we lost another Albany County resident to COVID, a resident in their 40s. My condolences to the latest families and to all the families that lost a loved one during these difficult times. My prayers and thoughts go out to all of you. Our death toll now stands at 397, and unfortunately, 8 Albany County residents have passed away in these last 6 days, which is alarming. And some of the things, when we've been out, and Dr. Whalen and I get this question all the time, why aren't you briefing again every day? Things have changed, and we have learned a lot from the matrix, wherever the state health department at the time had all the matrix that we had to go through and meet different requirements, which we did, because it was their playing field, their rules, and we met them, to now. And we learned a lot more now than we did 18 months ago. And if you listen to Dr. McKenna or Dr. Reed from St. Peter's, they talk about, hospitalizations and ICUs, beds, and everything else. And we have to change and adapt as this continues to go on. You can't stay locked up forever. We have to move on. So following the science, though, because I've always said that, Dr. Whalen, following the science. And trust me, depending on which way we go, and we just need to be vigilant. And that's all I say to everyone, please be vigilant. Dr. Whalen talked to us about the booster shot, the vaccine shots for kids under 12, like I said. But the good news is, like I said, our kids are returning to the classroom, and some are half days. Some schools are half with students at times until they go back to full days, which is next Wednesday, I believe. Right? Correct. Next Wednesday. And Superintendent Adams is here to tell us about that, and thank you for coming in to talk about that. But the bottom line is that we don't want to go backwards. We won't want to move. We just want to move forward and do it safely. And the only way we're going to do that is just reminding parents and everyone else how to move forward and do it right. We offer vaccine every weekday at our County Department of Health at 175 Green Street, still to this day, 9 a.m. to 3. If you don't need an appointment, you can walk in. We continue to offer free transportation for people over the age of 60. And please continue to make sure that you do that. But at this point in time, I do want to turn it over to Dr. Whalen before we move forward. Dr. Whalen.
Thanks, County Executive McCoy, and hello to everybody. I did have a feeling we were going to be back, and I know at the last press conference we talked a little bit about concerns related to the Delta variant, and of course, where we find ourselves now in New York State is that we are seeing cases that have increased tenfold since early July. And now 95% of the virus that's sequenced across the state are the Delta variant. We know the Delta variant is more highly contagious, and we believe that this is directly responsible for the spread that we are seeing. We are also seeing several trends develop. And before I get into those, I want to talk about information and how we share information. I think that it's been highlighted at the CDC level many times and at the national level that we are facing a pandemic of misinformation. And this misinformation causes confusion, causes anxiety, causes stress for all of us. And it unfortunately fuels a lot of conspiracy theories and concerns, so people feel like they don't know which way to turn. And I want to try to address that. One thing that I would like to say first off is that the situation is rapidly evolving and changing. We in public health are working with a situation that's unprecedented. We have a virus that is new, that is evolving and changing. So information that we presented to you in April, when we were able to provide statistics on protection, on ability to go without masks once someone was fully vaccinated, no longer pertains. That information was pertinent to the Alpha variant, and the Delta variant has been an unfortunate game changer. So while the information that we're sharing with you may not be the same advice we were giving in April, the reason for that is because the virus has changed. The game has changed. And because that game has changed, we are now getting as much information as we possibly can to inform the public on best practice. It is going to be different information. And I think that all of us have to say right off the bat that we understand that. We understand that this virus is changing. We understand the virus could undergo future mutations. And really, when we talk about the strategies of vaccine and community mitigation strategies such as masking, what you're doing is doing your part to prevent that from occurring. We know currently the World Health Organization is looking at the latest variant, which is the Mu variant. It is not a variant of concern yet, but it is prevalent in South America, and particularly Colombia. It is starting to be prevalent, and it is a possibility that this virus may evade protection by the vaccines. So just as I talked about concerns about the Delta variant in April, I'm going to talk about that concern because these are the eventualities that we will come to if people are not on board with the mitigation strategies that are currently being promoted. So in addition to a precipitous rise in cases, we are also seeing a rise in breakthrough infections. What are breakthrough infections? These are COVID-19 infections of individuals who have been fully vaccinated. When we spoke last in June, we had information that the rate of breakthrough infections was very low. That has changed. If I look at statistics in Albany County, and again, these are very rough looks at statistics. If there are people out there that are used to processing statistical information, you know you have to clean data. This is data that is rough. Out of the 1,870 cases that we had between August 1st and August 31st, 826 of those were vaccinated people. So that is a very high rate of breakthrough. And again, another caveat with that is self-reported. These people report to us that they have been vaccinated. So this is a concern. When we look at the deaths that we have seen across the county, and I want to talk about particularly the deaths that we have seen in the last 8 days, or the last 8 deaths that we have had since August 27th. These individuals are younger. I want to say right off the bat, I am not going to be releasing from our department with death data for an individual, whether they were vaccinated or not. I think that it's important to be transparent with the public, and I'm going to give you the information in aggregate of these 8 individuals. But to give the vaccine status on an individual, I think it's a privacy concern. I think it's an ethical concern. These people are terrible losses to their families, and they don't need to be burdened additionally by the reporting to the press of whether they were vaccinated or not. So we will share this information with you. I'm happy to share it with you, but it will be in aggregate form. And this is what I can tell you about the 8 deaths that we have experienced. The age range of patients is lower than what we had previously seen in our spring surge. The youngest patient was in their 30s, the oldest was 70, and the mean age of these 8 individuals was 53. That's 1 in the 30s, 2 in the 40s, 2 in the 50s, 2 in the 60s, and 1 in 70s. 4 were men, 4 were women. 4 were Black non-Hispanic. 1 was Asian, 2 were white non-Hispanic, and 1 was white with unknown Hispanic status. All but 1 of these individuals had medical conditions. There was 1 unvaccinated individual who had no past medical history. So this is a person that was young and healthy and had no history of medical illnesses and was unvaccinated. 4 of the deaths were in fully vaccinated individuals, and an additional death reported being vaccinated, but we were not able to confirm this. Of those 4 cases, they were all affiliated with congregate settings, and 1 had a prolonged hospitalization for other health conditions. Of note, all of the deaths that were fully vaccinated or reported full vaccination were affiliated with congregate setting or had a prolonged hospitalization to other conditions. The unvaccinated deaths were younger and healthier. Now, this is a small set of data. And what inferences can we draw from that? If you look at data, you know that a small set like this can do something called generate hypothesis. So you could look at this and say, here's what I think from that, but I cannot prove that until I have data with more people. And that data is substantiated nationally in reports that we have been issued this month from the MMWR. What does that data show us? The data shows us that the vaccine is still effective against hospitalization and death. But we are seeing waning effectiveness of the vaccine over time. And if you look at the general biology of how vaccines work, when you get a vaccine, it helps your body make antibodies. Your body does this with what it has. So if you are in good health, if you are a person that doesn't have medical conditions or immune compromise, if you are not necessarily elderly, it is likelihood that your body will do a better job of creating that immunity. And we are very closely following the timing of when we see this immunity wane. For this reason, I am still joining all health, public health, and national experts to encourage people to still get vaccinated. The reason for this is that this is the best protection we have. It is not the level of protection that I was happy to report out in April, but it does make your body produce these antibodies that can help you fight off infection. And if you do not get vaccinated, you run a much greater risk of hospitalization and death. But what we know from this is that vaccine by itself is not enough. And when we are in areas such as Albany County with high prevalence, and our test positivity rate this morning was 5.1% positive, which puts us in the high prevalence category, there are additional strategies that you need to do to protect yourselves, and these include masking, and these include social distancing. So for that reason, we are really continuing to encourage these behaviors to help people protect themselves. And if you have not been vaccinated, get vaccinated. Because what we don't want is for people to feel that regret that I could have done something to prevent this from happening with my family, with my loved ones. So vaccination is still our best bet. Now, when we talk about vaccine, and I want to highlight, a great paper that came out from the School of Public Health, and give a shout out to my colleagues, the Dean of the School of Public Health, Dr. David Holtgrave and Dr. Eli Rosenberg, provided some great information on the vaccine effectiveness. This came out August 18th. It was on new COVID cases, hospitalization among adults. This data was from May to July. So again, already this data is a little bit old, but it did show that currently available vaccines do have high effectiveness for preventing COVID infection, for preventing hospitalization, but we are seeing vaccine effectiveness wane over time. So what does that mean? That is where we get into the discussion around boosters. The first thing that I want to do is clarify a misconception. At this point, boosters have not been authorized by the FDA, nor have they been signed off by the Advisory Committee on Immunization Practices. What the CDC has advised is that if you are a person that has immune compromise, and this is a small subset of individuals, this includes individuals who are undergoing active treatment for cancer, who have had an organ transplant or a stem cell transplant, who have a primary immune deficiency syndrome, have advanced or untreated HIV, or on high-dose steroids. For these individuals and these individuals alone, a third dose is currently recommended that can be given 28 days after completion of the initial series. The timing on the booster series has not yet been established. I know as much as you do. So in the press, we see 5 months, 6 months, 7 months. Those are recommendations that we are anticipating. And what we have been told by the CDC is that we are to anticipate those recommendations and to start preparing to roll out booster shots by September 20th. So once we get that guidance, we will be prepared to move forward quickly to be able to work with our partners to vaccinate those that are due for boosters. It is important to note that, the prior vaccination efforts were really during a public health emergency. We really look to expand vaccination partners, including primary care physicians and including pediatricians when we get that authorization, which I'll talk about in a moment, so that people can be vaccinated in the place where they normally get health care. We've had phenomenal partnerships with the pharmacies, with the hospitals, and with many of our community partners, and we will continue to work with them to get these vaccines out once we get the protocol and authorization for booster shots. In terms of children under 12, at this stage, there is no authorized vaccination for children in that age, nor do we have an EUA for children that age. We are told that the likelihood is that we can anticipate this in late fall. So that is not something that we are expecting immediately, but we are preparing for it. And I believe that parents feel best when they can get their children vaccinated where they get their normal vaccines, so we are working with the pediatricians to try to ensure that they are able to provide those vaccines when we do get that authorization going forward. It's not the position that I had hoped to find ourselves in. And I believe that a lot of what we are dealing with now could have been prevented if we had better uptick of vaccination when the vaccination first became available, and if people had adhered to the strategies around masking and community mitigation. I understand the concern, I understand the fear, but with the cases that we are seeing, it is important that we take action and we get this information out to the public on how to best protect yourself and your family. So I continue to urge vaccination. If you have questions, if you have waited, if you have held off and said, I'm not comfortable with this, please call us to discuss. Please get information from trusted sources. What we are trying to prevent is further hospitalizations and deaths, particularly in younger individuals. Younger individuals with the alpha variant, and we know, had a level of comfort that if they got sick, they weren't going to get that sick. That is not there anymore. That comfort level is not there anymore. So we want to ensure that our 20-somethings, our 30-somethings are vaccinated, that everyone that can be vaccinated, and that we are utilizing important mitigation strategies such as masking. I applaud Governor Hochul's swift action to mandate masks in the K-12 population, and I'm very happy to have Superintendent Adams here today. She's been a phenomenal partner throughout COVID and has worked very carefully with us to ensure the health of her students. We want to make sure that we are protecting people. We want to make sure that we are protecting the most vulnerable residents. And again, if you look back to the deaths that we have seen in the last 8 days, 50% of those deaths were in Black non-Hispanic individuals. We know that this demographic of our community is disproportionately affected. We want to make sure we are protecting people. So getting the appropriate information on vaccine and protecting your family and utilizing important strategies around masking and strategies around surveillance testing, which we are working with the schools to implement, are going to be very important. I agree, as all of us do, that the past couple of years have been particularly hard on children. So in addition to having the pandemic of COVID-19, having the pandemic of misinformation, I believe there's been significant toll on mental health, and particularly children. I know that there are many parents that are against a mask mandate. I want to share with you that there are many studies that support the efficacy of masks in preventing transmission of COVID-19. And there's 49 studies in a recent Popular Press article that will give you that data. I also want to share for parents that do have this concern, children will respond to your attitude. So please, we know that these masks are going to be mandated for children. They will take their cue from you. If they feel that parents are very angry and very upset, this filters down to the children and it is not helpful. It's a mandate at this point. So to help your children get through this, any positive reinforcement that you give them will be more helpful than to see the stress. Children are fragile, children are precious, and children are going through a lot now. And we want to make sure that we can help them get through this and protect them as we continue to evolve. I give you my personal promise that I will always provide you with the information that I have that is evidence-based, that is from trusted sources, and that is based on science as the science evolves. It's the best we can do. So please don't hesitate to get further information on our website or to call the health department. We have health educators that can speak to you and address concerns. As Dr. Adams knows, we are going to have a call this afternoon with the school districts. The State Health Department yesterday released additional guidance for schools. We know that there's a mask mandate, and there is also a mandate in place to ensure that testing is available for children. And surveillance testing, again, testing of unvaccinated or testing of asymptomatic individuals can be very helpful in early identification of infections and making sure that people that are infected stay home and don't infect others. So those important strategies are going to, we'll be hearing a lot more about those as school opens, and we look forward to partnering with our school districts, all of who have been very proactive in sharing this information with their public, with their families going forward. I will continue to share information as it becomes available, and look forward to continuing to working with all the residents of Albany County and with all of you.
Thank you, Dr. Whalen, as always, and appreciate your insight on this, and hopefully people heard what you had to say. But Superintendent Adams, I'm glad to have you here, and I really want you to talk about the challenges, and I have to say to the parents that are out there, you don't understand the pressure superintendent's been under, principals, school teachers, just the workers in general that work in a school district every day to make things happen for our children, and dealing with parents that might not, again, or I don't want to use the word stable, but are having issues dealing with their kids going back to school with masks and anxiety and the kids coming back, which my daughter hasn't been back in school since last March. She's starting her senior year at Albany High School, and she didn't want to go back. She's like, I'd rather be remote for nothing for the rest of the year. So you're dealing with that aspect too of being remote and not wanting to go back into crowds. And I want to just do a plug-in, and I don't want to throw the superintendent on this. People who are looking for jobs, school bus drivers. I have talked to different superintendents, but I have talked to bus drivers directly, and I have talked to people that run them. Bethlehem sent a letter out to their parents early on. Please, if you can drop your kid off, do it, because they got a shortage of buses, and you can only put so many kids on a bus. So they're rearranging their schedules. They just sent another letter out. I know Colony, Peter Tunney, who's actually a county legislator that runs the town of Colony buses for their kids, said the same thing. Huge shortage of drivers, and not enough time to get kids there. So it's going to be a challenging year. So if you're looking for a great job and to interact with kids, please, you can walk into Bethlehem, Colony, Green Island, Burnox, well, anywhere in Albany County, and I can assure you, you'll probably start tomorrow. And if you don't have your CDL, they will train you. And some of them are giving you bonuses to go work for the school districts to help get these kids there. And I know that's been a nightmare for the schools to coordinate just getting kids there safely on a bus, wearing masks and everything like that, and then getting to school. But Superintendent Adams, please.
Thank you so very much. I do appreciate the opportunity to be here. We in the City School District of Albany are working very, very hard to make sure that we are bringing our students back safely to our schools. And we always start with our vision, mission, and goals because we want to ensure that we have equitable learning environments for our students. We want to make sure that we are building robust learning programs for our children. But one of the things that I think over the past 2 years that we have been really looking at is the social emotional well-being of our students. And so when we look at our district priorities, last year we did a survey with all of our stakeholders, and across the gambit, every stakeholder group ranked social and emotional learning as being the #1 concern. We know that regardless of whether students were in person or virtual in their instructional process, we know that there was a feeling and a sense of disconnectedness that you can only get through being in person where you are engaging in learning firsthand. And so I do want to take a moment to applaud all of the efforts of our teachers and our support staff and our administrators, because the City School District of Albany rallied and made sure that we could close that achievement and opportunity gap, or access and opportunity gap to technology. We were able to do that. We also made sure that we were able to provide food for our families, and I reported on that before. And we wanted to make sure that we had the proper PPE for our students. And as we move forward, our priority of social and emotional learning is going to be at the forefront of everything that we do. And so academics are not second, but they are coinciding with the social and emotional learning because we know that they go hand in hand. We're also looking at educational technology. We're looking at the safety and security of our students, making sure that our decisions with regard to how we come back to school and what we are able to allow and participate in, that we are following the guidance and we are following the data and we are listening to the medical professionals as to what is in the best interest of our students. We're also looking at our ventilation and air filtration, in that all of our systems and all of our buildings, they meet the state requirements. However, through our ARP money, our American Rescue money that we have received, we are looking at what enhancements we can do with regard to our ventilation and filtration, air filtration. Also, the accelerated learning and academic support for our students. We are also looking at what are those things that we need to do to make sure that we are accelerating the learning of our students, still engaging in project-based learning, looking at higher level thinking skills. And our theme for the 21-22 school year is going to be on how we operationalize equity and how we move forward through the pandemic with regard to making sure that we have equitable decisions that are being made on behalf of our students. As we come back to school, yes, we have received some recent guidance yesterday with regard to mandates and further guidance that we will need to implement. And so we have already posted our back to school plan, and we are looking at what those procedures are that we may have to tweak a little bit based on that guidance. However, as we come back, we are still aligning with the guidance from the federal, state, and local health, education, and medical professionals. We had 2 days of orientation yesterday and today for our students, and our first full day of instruction will be September 8th. When we come back, we are looking at masks inside, regardless of vaccination status, 3 feet social distancing where feasible. We are strongly encouraging the COVID-19 vaccination for all those who are 12 and older and who are able to get the vaccine. We do have our polycarbonate dividers that we are using as appropriate. We do the temperature screenings as people are coming into the building, so each person will be screened with the temperature screening at this point. We are continuing with our hand hygiene protocols, our cleaning and sanitization of our buildings, as well as proper building ventilation. And so while we know that this year will continue to be different, but we are still trying to get back to as much normalcy as possible, but we are absolutely following the COVID protocols and guidelines as we open our school year. So thank you very much for this opportunity.
Thank you, Superintendent, as always, and appreciate the update. And again, it's been challenging for you, moving here, taking over a new school district, changing the culture, cohesiveness of an organization, and dealing with COVID-19. So like everyone else, things got to be different. I do want to say, we are, and I kind of got ahead of myself, that's what happens after 70, 80 days of not doing this. We are offering the shot, like I said, at 175 Green Street from 9 to 3. And for 6-year-old, the number is 518-447-7198. If you need assistance, please call that. If you're unable to leave your house, you can still call us. We'll come to your house, 518-447-7198. Also go to our website at albanycounty.com, and we continue to urge you to get tested and to do the right thing and get vaccinated. Like Dr. Whalen said, you can talk to her team. You can walk into the health complex and talk to somebody, go talk to your own doctor. But we do need to get fully vaccinated, and again, to step in the right direction. So please continue to wear a mask now again. Cough into your arm, sneeze into your arm, clean your hands, and stay 6 feet apart. I'm hoping our numbers, and like Dr. Whalen said, it's just, at this point, we're just looking at the numbers going up. It's after the summer of traveling. Unfortunately, when everything looked like it was reopened, people were going to states that weren't vaccinated as high as us, and we never said you couldn't get it, that we're bringing it back, who got infected, and just gave it to people that weren't vaccinated. And you're going to hear the argument on everything that Dr. Whalen talked about, being vaccinated and the issues people had. It's just a tool in the arsenal that helps you and hopefully prevents you from passing away or staying in the ICU. And one of the things I meant to reach out to Dr. McKenna is how many actually in the ICU are on ventilated beds versus how it was last year. So these are things we have to look at, and hospitalizations are shorter than they were last year, so people are getting out quicker because the vaccine is doing its job, but nothing is 100%. We can plan for everything, we can hope for the best, and unfortunately you're going to have failures, and you just got to pick yourself up, dust yourself off, and re-engage and try something new. So to everyone out there, please be patient. I know it's hard. I know, like I said, you had to reimagine the world and the workforce and schooling and how we do things as a society, but we need to continue to go forward. And the only way we're going to do that if everyone remains calm, stop finger pointing, be part of the solution, don't be part of the problem. And like I said, it's a marathon, not a sprint. But thank you again to everyone here and to Dr. Whalen and her team.